If you're over 50 and still masturbating, there's something critical you need to know about your prostate health. Hello, gentlemen. I'm Dr. Pradip Jamnadas, a urologist with over a decade of experience helping men maintain their sexual and prostate health well into their later years. Today, we're discussing something most doctors won't talk about openly: masturbation after 50. And the research I'm about to share might completely change how you think about this natural activity. Harvard Medical School tracked nearly 32,000 men for 18 years. What they discovered was remarkable. Men who ejaculated 21 or more times per month had a 20% lower risk of prostate cancer compared to men who only did it 4 to 7 times monthly. 20% lower risk from something completely natural and free. But that's just the beginning. There are critical things about frequency, technique, and health benefits that every man over 50 needs to understand. Things that could protect your prostate, improve your sleep, reduce stress, and even support your erectile function as you age. Before we start, please hit that like button. Drop a comment telling me where you're watching from, and subscribe so you never miss important health information designed specifically for men over 50. Now, let me share what you need to know. Let me be direct with you. Most men over 50 have questions about masturbation but feel too embarrassed to ask their doctor. Is it still normal at my age? Am I doing it too much, too little? Is it affecting my health positively or negatively? Here's the reality. Research shows that 63% of men over 50 masturbate regularly. If you're doing it, you're in the majority, not the exception. Studies across Europe found that between 41% and 65% of men aged 60 to 75 reported masturbating in the past month. This is completely normal behavior that continues throughout life. But here's what frustrates me as a urologist. Most men have no idea that this natural activity provides significant health benefits, especially after 50, when prostate health becomes increasingly important. Your prostate grows larger with age. By 60, about half of all men have an enlarged prostate. By 85, that number reaches 90%. Prostate cancer becomes more common. Urinary function changes. Sexual function shifts. During all these changes, regular ejaculation, whether through partnered sex or masturbation, plays a protective role that most men never learn about. Today, I'm walking you through the 7 most important things every man over 50 needs to know. This information is backed by peer-reviewed research, and it could significantly impact your long-term health. Let's begin. Number 1, the prostate protection effect. This is the most important benefit, and the research is exceptionally strong. The Harvard study I mentioned involved 31,925 men followed for 18 years. The findings were published in European Urology, one of the most respected journals in our field. Men who ejaculated 21 or more times per month showed a 20% reduction in prostate cancer risk compared to those ejaculating 4 to 7 times monthly. This protective effect was consistent across different age groups but particularly notable in men over 40. An Australian study published in BJU International found similar results. Men averaging 4.6 to 7 ejaculations per week were 36% less likely to be diagnosed with prostate cancer before age 70. Here's the biological explanation. Regular ejaculation helps clear the prostate of potentially harmful substances. Your prostate produces fluid that mixes with sperm. When that fluid sits stagnant for extended periods, it can become a breeding ground for inflammation, infection, and potentially cancerous changes. Think of it like flushing a water system. Regular flow prevents buildup and keeps everything functioning properly. Ejaculation also reduces prostate congestion, decreases inflammatory markers, and maintains healthy tissue turnover in the gland. A patient of mine, 59 years old, with a family history of prostate cancer, was understandably concerned. After discussing this research, he committed to maintaining regular sexual activity, both with his wife and individually. 5 years later, his PSA levels remain excellent and his prostate exams show no concerning changes. This isn't a guarantee against cancer, but it's a significant protective factor you can control. If this information is new to you, please hit that like button right now. Number 2, the optimal frequency. Most men have no reference point for what's considered healthy or normal. The research shows that 21 or more ejaculations per month provides the strongest protective benefits. That breaks down to roughly 5 times per week. Some weeks might be more, some less, but averaging around that number appears optimal. This total includes all ejaculations, partnered sex, solo masturbation, and even spontaneous nocturnal emissions. It's the cumulative count that matters. For men over 50, especially those without regular partners, masturbation becomes an important health maintenance tool. The data shows masturbation rates are nearly equal between men in relationships and those who are single. This isn't about replacing intimacy with a partner. It's about maintaining prostate health regardless of relationship status. One critical point: more isn't necessarily better. The protective benefits plateau around 21 times monthly. Going significantly beyond that doesn't provide additional protection and could potentially lead to other issues we'll discuss shortly. A patient told me he felt guilty about masturbating 3 to 4 times weekly despite being in a happy marriage. After reviewing the research together, he understood it as a health practice, not a reflection on his relationship. His perspective shifted from guilt to seeing it as proactive health maintenance. Comment below. Were you surprised by the frequency that provides optimal benefits? Number 3, the critical mistakes to avoid. Not all approaches to masturbation are equal, especially after 50. There are mistakes that can cause real problems. First, inadequate lubrication. As you age, your skin becomes thinner and less elastic. Dry friction causes micro tears in delicate tissue, leading to irritation, scarring, and reduced sensitivity over time. Always use a quality water-based or silicone-based lubricant. This is an optional after 50. Second, excessive grip pressure. Some men experience reduced sensitivity with age and compensate by gripping harder. This creates a problematic cycle. More pressure causes more damage, which reduces sensitivity further, leading to even more pressure. Use a lighter touch and focus on varied stimulation rather than intense pressure. Third, excessive pornography use. While occasional viewing is normal, excessive consumption can alter your brain's dopamine response system. Some men find they cannot achieve arousal or orgasm without increasingly extreme content. This is a neurological issue, not a moral one, and it can interfere with real intimate relationships. Fourth, ignoring warning signs. Pain during or after masturbation, burning during urination, blood in semen, or difficulty ejaculating are not normal. These symptoms can indicate prostatitis, urinary tract issues, or other conditions requiring medical evaluation. Don't ignore them. Fifth, rushing through the process. After 50, your body responds differently. Hurrying can result in incomplete ejaculation, which doesn't provide the full prostate clearing benefits. Take adequate time and allow for complete, satisfying ejaculation. I treated a patient who developed chronic prostatitis from aggressive masturbation without lubrication. His symptoms included pelvic pain, difficulty urinating, and discomfort during ejaculation. After modifying his technique and using proper lubrication, his symptoms resolved within 6 weeks. Technique matters as much as frequency. Number 4, the mental health benefits. The benefits extend well beyond physical health. Masturbation triggers release of multiple neurochemicals. Dopamine provides pleasure and motivation, oxytocin promotes relaxation and bonding, serotonin improves mood, and endorphins act as natural pain relievers. Prolactin release during orgasm has documented neuroprotective properties. It helps protect brain tissue from stress-related damage. For men over 50 dealing with work pressure, retirement transitions, health concerns, or relationship changes, masturbation provides natural stress reduction without medications or side effects. Research shows that sexual activity, including masturbation, correlates with better sleep quality. The relaxation response following orgasm naturally prepares your body for sleep. A patient struggling with chronic anxiety and insomnia was reluctant to take prescription sleep medication. We discussed using masturbation as part of his bedtime routine. Within 3 weeks, he reported significantly improved sleep quality and reduced anxiety levels without pharmaceutical intervention. Your mental health benefits as much as your prostate. Stick with me because the next benefits are equally important. Number 5, supporting erectile function. Here's something many men don't realize. Regular ejaculation actually helps maintain erectile function as you age. Think of it as exercise for your vascular system. Achieving erections regularly promotes blood flow to penile tissue, maintains elasticity of blood vessels, prevents tissue atrophy, and keeps the erectile mechanism responsive. Men who cease all sexual activity often experience progressive erectile dysfunction. Without regular blood flow, the tissue begins to deteriorate. It's truly a use it or lose it situation. Regular masturbation maintains the physiological pathways necessary for healthy erectile function, even in the absence of a partner. I had a patient whose wife had serious health issues preventing intimacy for over a year. He stopped all sexual activity out of respect for her situation. When circumstances eventually changed, he couldn't achieve adequate erections. We worked on gradually reintroducing masturbation to restore blood flow and function. After 4 months, his erectile capacity improved substantially. Maintaining function requires regular use. Number 6, addressing guilt and shame. This is important, especially for men raised in religious or conservative environments. Many men experience what psychologists call masturbatory guilt, a psychological conflict between behavior and internalized moral beliefs. From a purely medical standpoint, I can tell you definitively that masturbation is a normal, healthy behavior with documented health benefits, particularly for men over 50. There is no scientific evidence of physical or mental harm when practiced reasonably and safely. If your religious or cultural beliefs create internal conflict about this, that's something worth exploring with a counselor or spiritual advisor. But the medical science is unambiguous. One patient told me, "I spent 50 years feeling ashamed every time I masturbated." Learning the actual science freed me from decades of unnecessary guilt. I only wish someone had told me this 30 years ago. You're not doing anything wrong. You're maintaining your health. Number 7, when professional help is needed. While masturbation is healthy, certain situations warrant professional attention. First, if it interferes with daily functioning. If you're masturbating so frequently that it impacts work performance, relationships, or daily responsibilities, that indicates compulsive behavior requiring therapy. Second, if you cannot stop despite wanting to, feeling out of control regarding sexual behavior, is classified as compulsive sexual behavior disorder and requires specialized treatment. Third, if you experience persistent physical problems, ongoing pain, bleeding, severe skin irritation, or inability to ejaculate, all require urological evaluation. Fourth, if it's replacing partnered intimacy entirely. If you're consistently avoiding sex with your partner because masturbation is easier or more satisfying, that's a relationship issue worth addressing with a couples therapist. The vast majority of men fall nowhere near these categories, but if any apply to you, seeking appropriate help is important and nothing to be embarrassed about. Let me give you a comprehensive framework for healthy practices after 50. Regarding frequency, aim for approximately 20 to 21 ejaculations monthly, roughly 5 times weekly. This can include both partnered sex and solo activity. The total count is what matters for prostate protection. Regarding technique, always use adequate lubrication. Water-based or silicone-based products work well. Protect your tissue from friction damage. Regarding pace, allow adequate time. Don't rush. Complete, unhurried ejaculation provides maximum health benefits. Regarding balance, if you're in a relationship, maintain variety between partnered sex and masturbation. Both have distinct benefits. Regarding pornography, if you choose to use it, do so mindfully and occasionally rather than habitually. Be aware of potential dependency developing. Regarding your body, listen to physical feedback. Any pain, discomfort, or functional changes should prompt medical consultation. Regarding psychology, release any guilt or shame. You're engaged in scientifically validated health maintenance. Follow this framework and you're optimizing the health benefits while avoiding potential problems. One couple I worked with had struggled because the husband masturbated several times weekly and the wife felt rejected. After discussing the health benefits openly, including her in the conversation, and establishing that this wasn't replacing their intimacy but complementing it, their relationship improved significantly. Understanding and communication resolved what had been a source of tension. Gentlemen, let me bring this all together for you. Masturbation after 50 is not something to feel embarrassed about, confused by, or ashamed of. It's a normal, healthy behavior with substantial, scientifically documented health benefits. The research is clear and compelling. Regular ejaculation, approximately 20 to 21 times monthly, significantly reduces prostate cancer risk, supports erectile function, provides mental health benefits, reduces stress, and keeps your sexual system functioning properly. Your age makes this more important, not less. Prostate health becomes increasingly critical after 50, and you have a simple, natural tool to protect it. Stop letting outdated shame, misinformation, or embarrassment guide your decisions. Start letting science and health evidence guide you instead. If you take one thing from this video, let it be this: you have the power to significantly impact your prostate health through regular ejaculation. Use that knowledge. If this information helped you, please hit that like button right now. Comment below and tell me what surprised you most about this research. Did this change your perspective? And subscribe for more evidence-based health guidance on topics other doctors don't discuss openly. I'm Dr. Pradip Jamnadas. Your sexual health matters at every age, and you deserve honest scientific information to make informed decisions. Take care of your prostate, take care of your overall health, and live with confidence knowing you're doing what's best for your body.